So I'll try to do a short one about not imaging pediatric head trauma patients. There's another video in the folder that addresses this very well also. I'll just kind of give you my version of it, which will be pretty similar. So when parents bring in a small child who has had some sort of minor head injury and they're bringing them in concerned, in my experience, they're actually usually not looking primarily for a scan, but they've just heard that, scans are what we need to rule out danger. And a large part of this conversation is convincing them and kind of helping reassure them that, you can rule out danger without a scan in a lot of cases. So again, it's rare in my experience that they are really, really insistent and very fixated on having to have a CT scan. Again, their concern is not, I need a CT scan. Their concern is that there's a serious head injury that might be missed or that their child might become very ill and that, they won't know what to do about that. So what I say is, I understand why you came in today. Head injuries can be really serious sometimes, and they can be really scary, especially right when they happen. If you saw it happen, it can be really frightening to see that. And so I totally get why you guys came in today. But thankfully, it looks like your child is very well. I did a very thorough exam. And then pause, side note, these are the kids to do, you're always going to do a thorough exam, but sometimes if the parents are very concerned, I'll do what I call the therapeutic physical exam, where you do the most thorough physical exam you've done all day long or probably all month long. And then you look at them with a very serious face and you say, everything is normal. So getting back, so I'll say, based on my exam, your child looks completely normal. I know they have, maybe they have a small, bump or small injury on their face or on their head. It's like, I can see that, but that doesn't look like it's anything critical. I have a super low concern that they have fractured their skull, that they have a skull fracture, or that they have any internal injuries from this. Because little kids trip and fall all the time and they play and they get injured all the time, we have a lot of really good research about this sort of thing. And so when we've looked at thousands and thousands of kids in research studies who've had similar injuries to what your kid had today, thankfully the majority of them, if we look at certain key features, like are they throwing up, are they acting themselves, do they have like a really large head injury, like much bigger than what your kid has right now that, that might show that there's a skull fracture or something serious underlying, underneath that. If none of those things are there, and thankfully today it doesn't seem like any of those things are an issue right now, the chance of having a serious head injury that we're going to miss is as close to zero as we're going to get. We usually can't get to complete zero in medicine, but, it's as close to a 0% chance as we can get that there's something serious going on. So I think it's completely safe for you guys to go home. There's not going to be anything to really worry about. The other thing that people worry about as well is, could they have a concussion? And, mild concussions can happen from this kind of injury, but those are not the sort of things that we see on CAT scans. Concussions really are more based on what the kid's doing and kind of, how their symptoms are. And so a scan wouldn't really help us answer that question. And based on what I've seen so far, I don't think that they have a concussion. I think that they're that the likelihood of that is super low as well. And then the other thing that I know people get worried about is it okay for my kid to go to sleep tonight? Because the old mantra used to be, you can't let kids go to sleep because they could have something serious wrong. And if you miss it, then they won't wake up. And that's something that can be really scary, to not be here and not be somewhere where there's, doctors or nurses to help if something were to happen like that. So again, because of all these studies that we've done on these thousands of kids, we've shown that when a child has no, red flag, alarm bell sort of symptoms, which your child, again, does not have, they're looking really good, then they're not going to have a serious head injury that's going to cause them to not wake up. Now, if they do have a mild concussion, what might happen is they might develop some nausea later. They might not feel well. They might have a little bit of a headache, but those are the sorts of things that they're going to get up and they're going to cry or they're going to come find you or something like that. They're not going to just not wake up. So it's okay to let them sleep. If you wake kids up at 2 a.m, which is what people used to do all the time before we had all these research studies, before we knew which kids were at risk and which kids weren't, people would wake their kids up at 2 a.m. The kid is sad and confused and upset and isn't acting right. And we had no idea if they're not acting right because they have a head injury or if they're not acting right because it's 2 a.m. and they're sad and they're tired. And so rather than have you, stress about trying to make that decision, just know it's totally safe for them to sleep through the night. If something happens, they're going to wake up and tell you. They're not going to just not wake up. All right, that was longer than I planned, but